After the age of 50, knees become weak, mainly because the natural protective cartilage becomes thin, the muscles around the knee lose strength, the bones lose density, and blood circulation becomes slow, which together reduce joint stability and increase pain during daily movement. As a person grows older, the body slowly changes. These changes do not happen in one day. They happen little by little over many years. One of the most important changes happens in the joints, especially in the knees. The knee joint carries the weight of the whole body. It helps in walking, standing, sitting, climbing stairs, and bending. Because the knee works all day, every day, it becomes tired with time. Inside the knee joint, there is a soft tissue called cartilage. This cartilage works like a cushion between two bones. It prevents the bones from rubbing against each other. In young age, this cartilage is thick and smooth. It allows easy movement without pain. After 50, this cartilage slowly becomes thin and rough. When cartilage becomes thin, the bones start touching each other more. This creates friction. Friction causes pain, stiffness, and swelling. Another reason is muscle weakness. Around the knee, there are important muscles, especially thigh muscles. These muscles support the knee joint and keep it stable. After 50, if a person does not exercise regularly, these muscles become weak and small. Weak muscles cannot protect the knee properly. When muscles are weak, more pressure goes directly to the joint. This increases pain and risk of injury. Bone strength also decreases with age. Bones lose minerals like calcium. This makes bones less strong. Weak bones cannot take weight properly. This makes the knee joint more sensitive to pressure and movement. Small stress can cause big pain. Blood circulation also becomes slow with age. Good blood flow is necessary to keep joints healthy. When blood flow is slow, the joint does not get enough oxygen and nutrients. Healing becomes slow. Inflammation stays longer. This increases stiffness in the morning and pain during movement. Body weight is another important factor. Many people gain weight after 40 or 50. Extra weight puts extra pressure on the knees. Every step becomes heavier for the joint. Over many years, this extra load damages the cartilage faster. Old injuries also play a role. If a person had knee injury in youth, that knee becomes weaker earlier in old age. Small damage becomes big problem later. All these reasons together make the knee weak after 50. Thin cartilage, weak muscles, weak bones, slow blood flow, extra weight, and old injuries combine to reduce knee strength and increase pain. Because of this, many people after 50 feel pain while walking, difficulty in standing up, stiffness in the morning, fear of climbing stairs, tiredness in legs. This weakness is not sudden. It is the result of many years of slow changes in the body. Daily knee exercises are simple physical movements done for about 10 minutes every day to make knee muscles strong, improve joint movement, reduce stiffness, and decrease pain without using medicine or surgery. After the age of 50, the knee joint becomes weak, mainly because the muscles around it become weak and stiff. The best natural way to protect the knee is regular exercise. Exercise does not mean hard gym training. It means slow, controlled, and safe movements that activate the muscles and improve blood flow. When a person moves the knee gently every day, many good changes happen in the body. First, the muscles around the knee become stronger. Strong muscles reduce pressure on the joint. They act like natural support for the knee. This makes standing, walking, and sitting easier. Second, exercise improves joint lubrication. Inside the knee, there is a fluid that helps smooth movement. When the knee is not moved, this fluid becomes less active. When the knee is moved daily, this fluid spreads well inside the joint. This reduces friction and stiffness. Third, exercise improves blood circulation. Good blood flow brings oxygen and nutrients to the joint. This helps in healing small damage. It also reduces inflammation and swelling. Fourth, regular exercise improves balance. Many old people fall because their legs are weak. Knee exercises improve control of movement. This reduces risk of falling and injury. The best thing about knee exercises is that they can be done at home. No machine is needed. No gym is needed. Only a chair, a bed, or a wall is enough. A good daily knee exercise routine should include 3 types of movements. First type is stretching exercises. Stretching reduces stiffness. It makes muscles long and soft. This improves flexibility. Flexible muscles allow smooth knee movement. Second type is strengthening exercises. These exercises make thigh and leg muscles strong. Strong muscles protect the knee joint. They reduce load on the bones. Third type is movement exercises. These exercises improve range of motion. They keep the joint active and prevent freezing of the joint. The total time for these exercises should be about 10 minutes. This short time is enough if done every day. Long exercise once a week is not as useful as short exercise daily. These exercises should be done slowly. Fast movement can cause injury. Breathing should be normal. Pain should not be forced. Mild discomfort is normal, but sharp pain is dangerous. It is very important to do exercises regularly. If a person does exercise for 1 day and then stops for 1 week, the benefit is lost. The knee needs daily care like brushing teeth. These exercises are especially useful for people with early arthritis, people with morning stiffness, people with difficulty in walking, people who want to avoid surgery. Daily knee exercises do not cure all problems, but they slow the damage. They improve quality of life. They reduce need for painkillers. They increase independence in old age. Many doctors recommend knee exercises before giving injections or surgery. This shows how important exercise is for knee health. If started early, these exercises can protect the knee for many years. Even people of 70 or 80 can benefit from gentle daily exercises. Regular knee exercises prevent surgery by making muscles strong, reducing pressure on the joint, improving movement, decreasing pain and swelling, slowing joint damage, and helping the knee work properly without the need for an operation. Knee surgery is a serious step in life, especially for people after 50. Many people fear surgery because it is costly, painful, and needs long recovery time. Some people cannot walk for weeks after surgery. Some people feel weakness for months. Because of these reasons, doctors always try to avoid surgery if possible. The first and most important method to avoid surgery is regular exercise. When a person does not move the knee, the joint becomes weak very fast. Muscles become thin. The joint becomes stiff. Pain increases. This condition pushes the patient towards surgery. But when a person starts daily knee exercises, the situation slowly changes in a positive way. The first benefit of exercise is muscle strengthening. Around the knee, there are big muscles in the thigh and leg. These muscles protect the knee joint like a natural brace. When muscles are weak, the whole body weight goes directly on the joint. This increases cartilage damage. When muscles become strong, they carry part of the body weight. This reduces pressure on the knee. Less pressure means less damage. When damage becomes slow, surgery is not needed early. The second benefit is reduction of pain. Pain is the main reason people think about surgery. Exercise reduces pain in many ways. Movement increases blood flow. Good blood flow removes harmful waste from the joint. This reduces inflammation. When inflammation reduces, pain reduces. Many patients feel less pain after a few weeks of daily exercise. The third benefit is improvement of joint movement. When a knee is not moved, it becomes stiff. A stiff joint is more likely to get damaged. Daily exercise keeps the joint flexible. Flexible joints move smoothly. Smooth movement reduces friction. Less friction means less cartilage damage. This protects the joint for a long time. The fourth benefit is improvement of joint alignment. Sometimes weak muscles pull the knee in the wrong direction. This causes uneven pressure on the joint. One side of the knee becomes more damaged. Exercise balances the muscles. Balanced muscles keep the knee in correct line. Correct alignment protects the joint and delays surgery. The fifth benefit is control of body weight. Extra weight is a big enemy of the knee. Every extra kilogram increases pressure on the joint. When a person exercises daily, body weight slowly decreases. Even small weight loss reduces pressure on the knee. Less pressure means less pain and slower damage. Another important benefit is improvement of confidence. Many patients stop moving because they fear pain. This fear makes the knee weaker. Exercise gives confidence. When a person sees that movement is possible without severe pain, fear reduces. More movement means more strength. More strength means less need for surgery. Doctors around the world follow a simple rule. Before suggesting surgery, they always suggest exercise therapy. They give patients 3 to 6 months of regular exercise. If pain reduces and walking improves, surgery is delayed. Many patients never need surgery because of this. Exercise does not rebuild destroyed cartilage, this is true, but exercise protects the remaining cartilage. It improves the function of the joint. It slows the disease. This delay can be many years. In many cases, surgery is not urgent. Surgery is needed only when pain is present day and night, walking becomes very difficult, knee becomes very bent or deformed, medicines and exercises give no benefit. Before reaching this stage, exercise can save the knee. Regular exercise also improves overall health. It improves heart function. It improves sugar control and diabetes. It improves balance and reduces risk of falling. All these benefits make surgery less risky and sometimes unnecessary. Many old people think surgery is the only solution. This is not true. In early and middle stages of knee disease, exercise is the best medicine. It is safe, it is cheap, it has no side effects. Daily knee exercises give power to the patient. The patient controls his health. He does not depend only on doctors and hospitals. This independence improves mental health also. Therefore, knee exercises are not only movements, they are a method to protect the joint, reduce pain, delay disease, and avoid surgery.